Hello, friends. Most seniors assume that if there were a program eliminating their Medicare costs entirely, someone at the Social Security Administration would have mentioned it. That assumption is exactly why 60% of eligible seniors are not enrolled in QMB, the Qualified Medicare Beneficiary Program, right now in 2026. The SSA does not administer QMB. They do not process the application. They are not required to send you there. And the cost of that silence is $185 every single month, permanently, for every month you are not enrolled. The silence has a face, more than one. Think about the seniors this gap swallows whole. Not the ones facing deepest poverty. They find Medicaid through caseworkers, through social services, through crisis pathways that kick in by design. The ones who disappear through this particular crack are the ones sitting just above the supplemental security income line. People who worked 30 or 40 years, paid into the system, and landed at a monthly check that feels, to them, like something. Not much, but something. A retired factory supervisor in Dayton, a school cafeteria aide in Stockton. Someone whose Social Security deposit lands in their checking account at $1,190 a month, and who has watched neighbors receive assistance, always assumed to be for people with less. The word Medicaid arrives with a temperature attached to it. Cold. Not for them. They sit at the kitchen table on a Tuesday morning, the radiator clicking, paperwork half spread in front of them, running the numbers the way they have always run numbers, without a calculator, the way their parents taught them. And the conclusion forms. Probably too much income. Probably won't qualify. The phone stays on the hook, and every month $185 drains out of an account that did not have it to spare, drawn from a program they legally qualify for and simply never found. That calculation, probably earned too much, did not emerge from ignorance. It emerged from a system that never stated the actual threshold anywhere a person in that situation was likely to see it. Here is what the threshold actually says. In 2026, QMB covers a single person earning up to $1,275 per month. A couple qualifies at up to $1,724 per month combined. These figures represent gross Social Security income, before the Part B premium is deducted at source, not after. That distinction matters more than it appears. Medicare automatically deducts the monthly premium before the check arrives. The deposit that lands in the bank account is already smaller than the number the government uses to determine eligibility. A senior comparing their deposit against the published limit may be comparing the wrong number entirely, and nothing in the standard SSA correspondence instructs them to check the gross figure instead. The Centers for Medicare and Medicaid Services tracks enrollment. The data is not hidden. The enrolled share of eligible seniors sits at 40%. 40. Roughly 4 million people who legally qualify are currently paying bills the federal government designed this program to cover. And the most common reason is not geography, not language barrier, not paperwork complexity. It is one specific assumption, that QMB is a Social Security benefit you apply for at the SSA. That assumption. That is the mechanism. It is not a Social Security benefit. The SSA does not administer it, never did. So what exactly does QMB remove? And what does remove actually mean in practice? The program eliminates the $185 monthly Part B premium. It eliminates the $1,676 Part A hospital deductible per benefit period. It eliminates every copay, every coinsurance charge, every cost-sharing obligation under Medicare, at every physician, every outpatient facility, every diagnostic lab that accepts Medicare assignment. There is no reduced bill. There is no discounted statement with a smaller balance due. Federal law prohibits any Medicare participating provider from sending a QMB enrollee a cost-sharing bill at all. Not reduced, not deferred, prohibited. Under 42 U.S.C. Section 1396A, most enrolled QMB seniors have never heard it stated in those terms. Most of the 4 million who qualify and remain unenrolled have no concept that such a prohibition exists, because the first call most of them made went to the Social Security Administration, and the Social Security Administration is not the agency that runs this program. They are not required to redirect callers to the agency that does. Which means the 4 million seniors currently paying bills they are legally entitled to have zeroed out. They are not failing the system. The system is simply not telling them which door to knock on. That door exists, and it is not the one most people try first. So far in this video, we have established 3 things. QMB eliminates the Part B premium, the Part A deductible, and every cost-sharing charge a senior would otherwise pay. 60% of eligible seniors are not enrolled, roughly 4 million people, and the most common reason is a single wrong assumption about which agency handles the program. But here is what nobody explains, and what the enrollment number alone cannot capture. A meaningful share of the seniors who are enrolled in QMB are still paying bills they are legally prohibited from receiving. The program works on paper. In practice, something else is happening between the provider's billing department and the senior's mailbox. And the cost is not abstract. There is a version of this story that plays out constantly, quietly, in houses across the country. A retired home health aide in Memphis enrolled in QMB for 2 years. She received a statement from her cardiologist, $43 for a follow-up visit. The statement looked like every other medical bill she had received in her life. The letterhead, the account number, the line that said amount due. She sat at the kitchen table, pulled out her checkbook, and wrote the check. She did not call to dispute it. She did not know there was anything to dispute. The $43 left her account and never came back. What she did not know, what nobody had told her, was that her provider had broken federal law by sending that bill. Her QMB status was visible in Medicare's eligibility system the moment the office ran her insurance. The provider was required to check. The provider agreed to check in writing when they signed their Medicare provider agreement. And they billed her anyway. That story is not unusual. It is the most commonly reported QMB complaint tracked by the Office of Inspector General. The majority of affected seniors paid the bill. The majority did not recover the money. Not because recovery was impossible, it is legally mandated, but because they did not know the bill should never have arrived. This is the part that does not appear in any standard Medicare summary. Federal law, 42 U.S.C. Section 1396A, is unambiguous. Any provider who participates in Medicare is prohibited from billing a QMB enrollee for any Medicare cost-sharing amount. Not limited, not capped, prohibited. The provider cannot claim ignorance as a defense. QMB status appears on the beneficiary's Medicaid card. It appears in Medicare's eligibility verification system, the same system every provider accesses before rendering service. A provider who submits a cost-sharing bill to a QMB enrollee has violated their Medicare provider agreement at the moment of mailing. The OIG can sanction them. Medicare can remove them from the program. These consequences exist in writing. They are rarely enforced. Which means the practical situation facing an enrolled QMB senior is this. The law says the bill cannot come. The bill comes anyway, and the senior, who does not know the law, pays it. The annual value of what a correctly enforced QMB enrollment delivers is $2,220 in Part B premium savings alone. At 2026 rates, that is 12 monthly premiums at $185 each, simply gone from the expense column. Add the Part A deductible, $1,676 per benefit period, and any senior with a hospitalization in a given year is looking at protection worth several $1,000s in a single admission. Add every copay, every coinsurance, every outpatient charge from every specialist visit across a full year. For a senior managing 2 or 3 chronic conditions, the total protection can exceed $5,000 annually. That is not a rounding error in a fixed income budget. That is the difference between a functional financial life and a slow, quiet crisis. And here is the piece that closes the circle on how 4 million eligible seniors remain unenrolled. The Social Security Administration does not monitor this. When a senior's income drops into the QMB eligibility range, because of a change in benefit amount, a loss of other income, a change in household, there is no automatic flag, no outreach letter, no call from a caseworker. The SSA has the income data. They have the contact information. They have no requirement to act on it. A senior can become eligible for QMB on January 1st and remain unenrolled through December 31st of the same year, paying 12 months of premiums that federal law would have eliminated, and the agency that sends them their monthly check will have said nothing. Which brings us to the question that should have been obvious from the beginning, and which most seniors only think to ask after they have already spent years in the wrong place. If the application does not go to the SSA, and it does not go to Medicare.gov, and 1-800-MEDICARE cannot process it, then who exactly is holding the door open? And why is that agency's name almost never mentioned in the same sentence as Medicare? The application does not go to the Social Security Administration. It does not go to Medicare.gov. It does not go to 1-800-MEDICARE. Those are the 3 places most seniors try first, and none of them can process it. The application for QMB goes to the state Medicaid office, a separate agency operating under a separate administrative structure that most Medicare beneficiaries have never had reason to contact. In most states, there are 2 ways to reach that office. A phone call to the state Medicaid program directly, every state has a dedicated line, or an application submitted through benefits.gov, the federal portal that routes to state-level programs. Some states also accept walk-in applications at local Medicaid offices. The process does not require a lawyer. It does not require a benefits counselor. What it requires is 4 documents. The first is a Social Security award letter, the official correspondence from SSA that states the gross monthly benefit amount, not a bank statement, not a deposit slip. The award letter, because the eligibility determination uses gross income before deductions, and only the award letter reliably reflects that figure. The second is 2 months of bank statements, checking and savings, to establish that no asset test disqualifies the applicant, in states where any asset review still applies. The third is the Medicare card. The fourth is a government-issued photo ID. Federal Medicaid regulations require state offices to process QMB applications within 45 days of submission. Not 45 business days, 45 days. If the state office does not act within that window, the applicant has grounds for a formal complaint to the Centers for Medicare and Medicaid Services. That complaint mechanism exists. Most applicants do not know it exists, which is why most states experience it rarely. There is a moment that happens at the Medicaid office counter, or on the phone when the hold music stops, that a specific kind of senior knows exactly. A retired textile worker in Greensboro, 68 years old, sits across from a caseworker with 4 documents in a manila folder she has carried on 2 buses to get there. She has been paying the Part B premium for 3 years since her husband died and her household income dropped. She looked up the QMB limits 6 weeks ago on her granddaughter's phone. She wrote the number down on the back of an envelope. She has carried that envelope in her purse since then. The caseworker pulls up the screen, asks for the award letter, types for 40 seconds, and says, "You qualified 3 years ago." The woman does not say anything for a moment. 3 years. 36 months at $185. $6,660. Gone. Paid. Unrecoverable. The caseworker hands her the enrollment form and says, "This takes effect next month. There is no mechanism to reclaim what was paid before enrollment. Federal law does not provide retroactive QMB benefits. The protection begins the month enrollment is approved. Everything before that month is simply lost." That is not a bureaucratic oversight. It is the design. Now, for the seniors who look at the QMB income limits and land just above them, this is not a binary situation. The program structure has 2 additional tiers that most people eligible for them have never heard named. The first is SLMB, Specified Low-Income Medicare Beneficiary. A single person earning between $1,276 and $1,528 per month qualifies. A couple has a corresponding range. SLMB does not cover deductibles. It does not cover copays. What it covers is the Part B premium, $185 per month, $2,220 per year, eliminated entirely, through the same state Medicaid application channel. Same documents, same 45-day processing window. The only difference is the income bracket and the narrower scope of coverage. The second tier is QI, Qualifying Individual. Single income between $1,529 and $1,715 per month. QI also covers the Part B premium only. But QI carries a constraint that SLMB does not. Enrollment slots are limited by annual federal funding allocation, and they reset on January 1st every year on a first-come, first-served basis. A senior who qualifies for QI but applies in October may be told the slots for that calendar year are full. The same application submitted the first week of January has a substantially higher probability of approval. That calendar timing, which almost no outreach material mentions, can mean the difference between 12 months of premium coverage and none. Both SLMB and QI applications go to the same state Medicaid office, the same 4 documents, the same process. The eligibility tier is determined by the income figure on the award letter. The applicant does not choose the tier. The office assigns it based on the calculation, which means a senior earning $1,400 a month who calls 1-800-MEDICARE to ask about help with their Part B premium gets told they do not qualify for QMB and hangs up. That senior may qualify for SLMB and simply was not told because the person they called does not administer SLMB either. 4 separate programs, 1 application channel, 0 automatic notifications when a senior's income drops into any of the 4 ranges. And that is the part that stays consistent across every tier, every income bracket, every state. The senior has to find it. The system does not come looking. What happens when a QMB enrollee does receive an illegal bill and actually knows enough to fight it is something most people would not predict. The process is real, the protections are real, but the way those protections actually work in practice is where this story takes a turn nobody expects. Here is what the complete picture looks like, and why the number is larger than most people expect. QMB eliminates the Part B premium. $185 per month, gone. It eliminates the Part A deductible, $1,676 per benefit period, gone. It eliminates every copay and coinsurance charge under Medicare at every provider who accepts Medicare assignment. For a senior in average health, That coverage is worth somewhere between $3,000 and $6,000 per year, depending on how often they use the system. For a senior managing multiple chronic conditions with regular specialist visits and recurring procedures, the number lands closer to the top of that range. But that is not the full picture. QMB enrollment does something that almost no outreach material mentions. It automatically qualifies the enrollee for extra help, also called the Low Income Subsidy, or LIS, the federal program that subsidizes Medicare Part D prescription drug costs. One application, 2 programs triggered. The extra help benefit is worth up to $5,000 annually in out-of-pocket prescription savings, depending on the medications involved. A senior on 3 or 4 brand-name drugs who enrolls in QMB and receives the automatic extra help connection does not file a second application. They do not call a second agency. The connection is automatic under federal rules. CMS transmits the QMB enrollment data to the Part D system. The senior simply receives a letter confirming extra help enrollment, often within weeks. Most seniors applying for QMB have no idea the second program exists. Most of the 4 million who are not enrolled in QMB are therefore also not enrolled in extra help for the same reason. One wrong assumption at the first phone call, cascading across 2 programs and potentially thousands of dollars per year. There is one rule about QMB that must be understood before any of this reaches the level of motivation. QMB is not retroactive. The savings begin on the first day of the month in which the state Medicaid office approves the application, not the month the senior first became eligible, not the month they first qualified under the income limits, the month the office processes the approval. Every month of delay between eligibility and enrollment is a month of premiums paid that cannot be recovered. There is no mechanism under federal law to claim reimbursement for premiums paid during a period of eligibility that preceded enrollment. The protection exists from the moment of approval. The clock does not run backward. That is the structural pressure behind every piece of information in this video. The program works. The eligibility criteria are accessible. The application is 4 documents at one agency, and every day that application sits unfiled costs a qualified senior real, unrecoverable money. If the application is denied, which can happen for documentation gaps, data entry errors, or administrative determinations, the senior has rights. A written denial notice from the state Medicaid office carries with it the right to request a Medicaid fair hearing. That request must be submitted in writing within 90 days of the denial notice date. The fair hearing is a formal administrative process in which the senior can present their documentation and contest the determination. It is not a lawsuit. It does not require a lawyer. It is a bureaucratic appeal, and it is legally mandated to be available. Most seniors who receive a denial do not know the hearing right exists because it appears in small print at the bottom of the notice and is rarely explained by the office issuing the denial. Not everyone who reads this far stays passive about it. There is a woman in Albuquerque, 71 years old, retired bus dispatcher, managing hypertension and type 2 diabetes, who found this information on her own at a library computer after a conversation with another senior in a waiting room. She enrolled in QMB 7 months ago. She applied for extra help the same week before she even knew the connection was automatic. When the confirmation letter came, she photocopied it, wrote the income thresholds in block letters on a note card, and taped it to the bulletin board at her church. She brought printed instructions to her neighbor. She called her sister in El Paso. She did not ask anyone for permission to share information that belongs, under federal law, to every senior who qualifies. That is what it looks like when someone decides the system's silence is not their silence. The decision to apply is not complicated. 4 documents, 1 agency, 45 days. The decision to share this information with someone else is even simpler. The application goes to the state Medicaid office, not Social Security, not Medicare. QMB eliminates Part B premiums, Part A deductibles, and all Medicare cost sharing, and triggers automatic extra help for drug costs. Combined annual value, $3,000 to $6,000, depending on health use. SLMB and QI cover Part B premiums for seniors slightly above QMB limits, applied through the same channel. If denied, request a fair hearing within 90 days. Do not wait. Before you go, subscribe and turn on notifications so the next change does not catch you off guard. And share this video with someone you know, a parent, a neighbor, a friend on Social Security or Medicare. They probably have not heard any of this either. I'll see you in the next one. The door was always open. It just never had a sign.